Hello everyone. So today we are going to learn how to make protocol for color therapy by using the Ayurvedic acupressure. Okay. So we'll go step by step. So step number one, as in the last video, we understand what are the 10 elements, how they are plotted on the finger, what are their color of tonification, and what are their color of sedation. And then we understand the basic attributes of those elements. So in this video we will start I will repeat the basic attribute of the element. So like Akash, it's basic when we will choose the Akash element, when we need to treat related to something softness or smoothness. Vayu, it is responsible for any movement or any function of any body organ or system. Agni we will choose when there is any burning or any inflammation or fever, like temperature related thing, or any heat related thing, then we will select the Agni. Jal, it is for the binding. It is used for the binding, or if we need to increase and decrease the temperature of somewhere, so we will increase the Jal because it gives the coldness. The property of Jal is coldness. Then Prithvi, when we treat either the hardness related issue or the humidity related issue. And Kal, it is responsible for any sensitivity in the body, like you get all sensation because of the brain and spinal cord. So if we need to reduce sensitivity of the brain related to any disease, we will consider the Kal. And Disha, we will consider if we need to change the direction of any element. For example, if we change the direction of the Vayu, we can use the Disha. And Man, it is to increase the threshold to bear any pain or any disease, because it is said like Man ke haare haar hai aur man ke jeete jeet. So by treating the Man, we can make our Man stronger, Man or the mind stronger. So now coming to the making the protocol, first example we are taking abdominal pain. Okay, so how we are going to make the basic protocol by using the color therapy. So there are two words, abdomen and pain. So first, abdomen, it is shown the part around the navel. Okay, so this part is occupied by the large intestine. Okay, there are other organs are also there, but largely it is occupied by the large intestine. If patient is generally saying I am having the abdominal pain, it is not showing any particular site, then we need to consider that we are treating on the correspondent site of large intestine. Okay, so I'll explain it later also, but like in this insect system you can see that large intestine, as we are using the insect corresponding system, and on the insect corresponding large intestine will come on the third phalange here. Okay, so by abdominal we choose the site. Now for the pain. Okay, so for the pain, Vayu is responsible for any kind of pain. Okay, wherever there is a less movement of Vayu, wherever there is a more movement of Vayu, it creates the pain. Okay, so first we have selected the element Vayu because of pain. Now second element, whenever we treat Vayu, we treat Akash also. Why? Because Akash shows the wideness. Okay, so if we see the example, if path is wide, okay, the Vayu flow will be less. If the path is narrow, the Vayu flow or the speed will be high. Okay, so here, as I said, pain is because of the more movement of Vayu. So we need to reduce the Vayu movement by sedating Vayu, but itself by increasing the Akash element. So by increasing the Akash element, we are increasing the wideness, the space, increasing the space, so there will be less flow of Vayu, or the less speed of Vayu. So first element Vayu, second element we selected Akash. Third element we are selecting the Kal. Why? As I said earlier, when we need to reduce the sensation of pain. Wherever there is having pain, we are getting to know only because of the brain. Okay, so we need to reduce the Kal. So by reducing the Kal, we are reducing the sensation in the brain. Okay, and fourth, we are using Now, in case if we need to sometime, because the gastric problem also causes the abdominal pain, okay? So in that sense, Vayu is going more down, okay? So we need to change the direction of Vayu in case if it is required. Mostly it is used in case of vomiting or the diarrhea. So here we are not considering the Disha, okay? Just leave it. And the last is, if it is unbearable pain, then to increase the threshold of our body, we are taking the element man, okay? So now how to treat these element? So as you can see in my hand, site is large intestine, so that is on the lower phalange, okay? So, and we know which finger is related to which element. So I'm just showing you in my left hand because I'm using the right hand to explain. So as I told, we need in the Vayu, that is the element number 2, we need to sedate, we need to reduce the Vayu movement. So we will go on the third phalange, we will make the shape of large intestine at the corresponding site by using the sedation color of Vayu element. And the sedation color of Vayu element is, it is indigo. Vayu element is blue, which is the color of Agni. That is, as I explained earlier, for sedation we use the bigger element, like 2 is the element, 3 is bigger element, so we'll use the color of 3 element to sedate the color of 2. So for Vayu we will sedate, and as I said, along Vayu we will tone the Akash. So we will use the Akash itself color for tonification, and Akash itself color is violet. Third is Kal. As I said, we will sedate the Kal, that is the element number 6. So on ring finger, again the sedation color of Kal is orange, okay? So I have made the orange color. Now Disha, not Man, okay? So we'll tone the Man is 8 element, which will come in this hand. So on this phalange we will go and will put the tonification color of 8, that is itself color of 8, which is the pink color, okay? So this is how, this is the basic treatment which we can use at home for treating any kind of abdominal pain. And most important thing, whatever I'm describing, it is a treatment, the symptomatic treatment. It is not, we are not treating the root cause, why there is abdominal pain or why this disease is happening. We are just treating what are the symptoms. It acts similar to the painkiller. Like when we get abdominal pain, we go to the doctor or to the medical shop and we take medicine just to relieve that pain. So we are not treating the cause, okay? So the same, this color therapy, the basic treatment which I'm telling now, it will just reduce your pain symptomatically. For the root cause, we need to go more in depth, okay? So same, any kind of pain. If the second example of pain, we can take the knee pain, okay? So here for the pain protocol will be similar. For the only the knee, that means the corresponding site will be changed. So as in this sex system, if you will see, if you will sit like this, and if you see the side of this phalange, the knee joint will come at the middle joint, side of the middle joint. So if you will see this finger, this is the middle joint, okay? So side of the middle joint will come the knee. And if you put the finger like this, this is the right knee, this is the left knee. So if you need to treat particular knee, you need to go there and treat. You need to put the color same as the pain protocol. So I'm telling that for the pain protocol, we tone the 1, sedate 2, sedate 6 and tone 8. So 1 and 8 tone, 2 and 6 sedate. Okay, this is the general protocol for the pain. So thank you so much. And this we discussed about the pain. In the next video, we will take some more disease and we'll treat accordingly. Thank you so much.